Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christina Armstrong.
And I'm Dr. Julie Ken.
Today we have a very special guest, Dr. Jason Owen. He is a clinical psychologist at the VA's National Center for PTSD in Palo Alto, California. Thank you for joining us today, Jason.
Glad to be here.
Jason, can you tell us about how the VA is using mobile health applications in mental health care?
Yeah, I'd love to. So VA has been using apps as part of clinical care and as a way of reaching veterans and anyone who's affected by PTSD since around 2011. It all started with PTSD Coach, which was meant to be a tool that anyone could turn to in a moment of distress or crisis that would give you ways to reach out for support and connection, ways to quickly bring down spiraling negative emotions, to learn the basics of how not just to survive, but to overcome PTSD, and ways to track progress over time. PTSD Coach has been immensely successful for reaching those that have never had or maybe never even considered mental health care, and for those that are already connected to care. We've learned a lot about how to provide care through mobile apps, and we now have a portfolio that includes 8 self-management apps, or apps that can be used on their own without a doctor or other healthcare provider, and 7 treatment companion apps, which are meant to support and extend some of the most widely used evidence-based treatments for PTSD, including prolonged exposure with an app called PE Coach and cognitive processing therapy with an app called CPT Coach. Taken together, our apps have now been downloaded over 1 million times, and we're proud that many of our users have no idea they're using a VA app. They just know it's an app that helps them manage their PTSD. It helps them learn more about how to manage their symptoms, how to help loved ones with PTSD, or helps them sleep or even practice mindfulness skills. We're also doing a lot of outreach to healthcare providers, both to let them know about how the apps might be useful to their practice, but also to learn as much as we can about how to make our apps work even better for their patients.
That's fantastic. Christy and I both use these apps all the time with patients and, of course, in our trainings that we provide across the DoD. They're great apps. We'll have all the links in the show notes, but where do you usually direct users to go to get all the apps?
So the best way to learn more is to check out our website. It's myvaapps.com, which has information about how to get the apps on your phone or tablet. It's got handouts, video tutorials, newsletters, and more. The best way to get started, though, is to download an app and try it out. So if you visit either the Google Play Store or the App Store for Apple devices, just search for PTSD Coach, and you're able to see that app as well as all the other apps VA has developed.
Jason, in your opinion, what have been some of the obstacles that providers have had to overcome to begin using technology in clinical care?
Well, I think time, it takes a little bit of time to learn about an app, to figure out how to download it, to figure out how it works. And, I think that's the biggest barrier. I think most of the time, once somebody actually gets it on their device and takes a look at it, they're pretty intuitive, and it's pretty, it doesn't take that much time to figure out how you might be able to integrate this into your care. There's also a lot that's in each of these apps. They're kind of packed with tools and assessments and information. And so providers sometimes just don't even know what all is available in the apps. And I think that's what's so great about the provider trainings that you guys do and that our team has been doing, is that it gives us some time to really unpack all that and show providers what's available in the apps and how they can use them in their practice. And I think once they see that, people light up a little bit and they're pretty excited to think about how to try these with their patients. Another barrier is we try to get all of the apps available for both Apple devices and Android devices, but sometimes it takes a little time to catch up on one platform or another. And so if you happen to be an Android user and an app is only available on an iPhone, then that's tough. But that's something we're trying to get worked out.
Yeah, that's a good point. One of the things in the training Christy leads is we like to have folks actually switch phones with others so that an Android user just tries out an iOS phone and vice versa.
Yeah, I think that's great. And one of the nice things about our apps is I think if you learn one on one type of device, they look and feel very similar on the other device. And so it's not that difficult to transition or show a patient who has an Android device, if you have an iPhone or vice versa, how to use the app.
Yeah, I agree. Your apps especially are very consistent across platform. So Jason, any starting out advice you would give somebody if they were just starting to use apps in treatment?
There are a lot of tools in here. And so I think if you can find one tool, it's, relaxation is one, or mindfulness that you maybe use as part of your practice or as one component of an intervention that you do with your patients. Those are great ways to start because you can try a tool, you can send it home with your patient, you can recommend it as homework, and then see whether that's something that they enjoy doing or not.
That's great advice. Jason, so tell us what's next on the horizon for your team.
Yeah. So, there are a lot of exciting things going on. There are a lot of moving parts. We have a lot of great folks that are working on all of these products, and we're really excited about all that. I guess there are a few things I would highlight. One is that we just released a brand new version of our Mindfulness Coach app. It's out for Android now, and we think the iOS version is going to come out really pretty soon. And as you know, there's a lot of evidence coming out about the benefits of mindfulness for reducing stress, for helping with pain, even reducing symptoms of PTSD. Mindfulness Coach has been one of our most popular apps. And even though there are lots of great mindfulness products out there, what sets ours apart is it's completely free. It doesn't require you to purchase anything to unlock any content. It's completely private. It doesn't share your information. It means we don't collect or share any personal information at all. It's a beautiful app that I hope people will check out. And what we want providers to know is that there's one really cool feature built into this app. So if you're a provider and you use specific relaxation or mindfulness exercises as part of your clinic or your program, for the first time, we have the ability to rapidly and easily load new exercises into the app. So you can give us a call, send us an email, let us know which exercises you'd like to include in the app, and then we can make those available for download to anyone who has that app on their device. So we think that's pretty cool.
That's amazing.
Yeah, we're excited to see how it works. We've had a lot of interest from providers that just have, their own way of doing things. And so it's nice to be able to have an app accommodate your specific practice. Another thing is that we have a number of new apps that are currently in production that we're really excited about. So there's a new update to the Family Coach app, which is meant to help family and friends cope with the stress of having a loved one with PTSD. And so that'll be coming out really soon. There's also a new app specifically designed for couples that are dealing with the consequences of PTSD, which we call Couples Coach, that will provide some basic relationship building and relationship repair skills. And it's meant to be used together with your partner. There's also MST Coach, which is designed to support the unique needs of veterans and service members who've experienced any type of military sexual trauma. We're also working on Insomnia Coach, which is a self-management version of our popular CBTI Coach app. So this app will bring some of the basic skills and sleep tracking capabilities from cognitive behavioral therapy for insomnia and make it available to a much broader audience so that you can hopefully get some of the benefits of that treatment, even if you're not working with a sleep specialist.
Are you sick of people asking when you're going to make the Coach app?
The code, yeah, there are actually, so there's a lot of, as I mentioned, there's a lot of stuff that's packed into the apps, and we have a lot of tools that are distributed across a lot of the apps. So that's something we definitely have in mind. We don't have immediate plans to build Coach, but I like that idea. As silly as it sounds. The last thing I would mention is that we're working on making many of our apps capable of sending and receiving data. So for users who opt in to these kinds of features, we can more easily connect them to their provider, which would allow providers to help them track their symptoms or to provide remote coaching. So these capabilities are really important to telehealth providers who work remotely with their patients, but also to researchers who want to better understand both how users are interacting with apps and whether they're benefiting.
Thank you so much, Jason. Thanks for joining us today on Next Generation Behavioral Health. Please let us know what you thought about today's episode and if you have any questions for Dr. Jason Owen or the other experts at the VA.
Check our show notes for the links that Jason mentioned and the email address to get in touch with him and his team. You can subscribe to our podcast on iTunes and Google Play, and thanks so much to those of you who've given us a rating.
Next Generation Behavioral Health is produced by the Defense Health Agency.